Hi, let's talk nutrition today. Unlike what we have in most places back home, nutrition and diet is well developed here. Nutrition and diet is well blended into the treatment plan. So each facility will have a registered dietitian or nutritionist, and then a provider, that's a doctor who prescribes diets. The provider and the registered dietitian or nutritionist work together to come up with the diets that each patient is to have during their period of hospitalization. So obviously we know what nutrition does. It helps to develop a great immune system. So it puts the patient in a better position to fight off infections. And then there is the issue of it providing nutrients. There is also the prevention of weight loss. So we know that it has a lot of advantages for a healthy person, and even more so for someone who is sick. So basically, there are different kinds of diets that a patient can be placed on. It can be placed on a cardiac diet, a diabetic diet, renal diet, full liquid diet, which is diets given to patients that find it difficult to swallow or chew or digest food. And then there is also the puree diet, which is given to patients with difficulty in swallowing and chewing. There is also the mechanical diet, which it's more of, the mechanical refers to the texture of the food. So it's soft food with low fiber that patients can easily, patients in that category of need can use to meet up with their nutritional needs. And then there is the clear liquid diet. That's it's kind of a short-term diet that patients get if they cannot eat solid food, so that they can have calories through it. So there is the regular diet. That's the normal diet, just as the name implies. So apart from knowing the kind of diet your patient should be on, you should also find out specifics about, the diet, because sometimes the patient can be on a regular diet, but the consistency should be, they want a certain consistency for the food, maybe minced and moist. They might want it in small bite sizes. So depending on the condition of the patient and the unique challenges of the patient, those decisions are made. So what are the implications for nurses? 3 basic things. Number 1 is read your orders. Make sure you read each patient's diet to know specifically what the patient needs to get. Sometimes it may not necessarily be a diet, but the patient might be on fluid restriction, so you should know that. The patient might be restricted from getting free water, depending on the person's condition. The patient might be restricted from sodas or certain kinds of drinks. So the bottom line is, make sure you read the patient's orders to know exactly what your patient needs. Number 2, there are times where you as a nurse may answer the call light of another nurse, and the patient may be asking for one thing or the other. Make sure you clarify with that patient's nurse to know if the patient can have that thing he or she is asking for before you go ahead and give it, so that you don't violate, the diet that the patient is supposed to be on. Then another thing to take note of as foreign nurses is that their own kind of food is different from our own kind of food. When you say diabetic diet, you have some kind of food in your head that you are familiar with that a diabetic patient should not get. But in their own case, it's not the same kind of food, of course. They have a different, they have different kinds of food, and the way they eat their food is not the way we eat ours. We eat bulk amount of food per time, but they eat different kinds of portions of food per time. So familiarize yourself with what consists of a cardiac diet, a diabetic diet, a renal diet, so that when your patient is asking for something outside of that diet, you know that he shouldn't have it. Their snacks are also different. Likewise, their drinks. So take note of all those things so that you can give the best to your patient. So bottom line is check your orders, check your orders, check your orders, and follow the prescription. Thank you for listening. Make sure to like, share, and follow for more.